Plantar fasciitis, while it's pain along the bottom of the foot, it really is coming from the fact that your ankle joint isn't functioning the way that it's supposed to. So if we use that common foot problem of plantar fasciitis and we get the space in the joint to be the way that it should, get the Achilles tendon along the backside to be as stretched out as it should, get the ligaments to do a much better job preventing side-to-side motion, then what starts to happen is that plantar fasciitis not only gets a chance to go away, the tissue gets a chance to heal, and the problem doesn't become this reoccurring thing that means I can't wear certain shoes and things along that lines. If you've had an ankle sprain, even if you had one 20 years ago, what will happen is those ligaments on the side, while they heal, they don't tighten back down the way that they're supposed to. And so you end up with excessive movement, which sets you up for problems like additional ankle sprains, arthritis, but most commonly, again, for plantar fasciitis. Plantar fasciitis is most commonly seen in people that have had repetitive ankle problems that didn't get treated correctly and handled and fully healed. We prevent all of those problems from occurring or from getting worse by making sure that the space in the joint stays as open as possible. You do that by making sure that you've got good mobility, especially in that upward direction, what's called dorsiflexion, by trying to limit and make sure that the ankle is as tight as possible in that side-to-side motion so that you don't get side-to-side shifting. And you prevent that by stretching and strengthening. Now, it's very easy to strengthen for the up and down motion, but it's very difficult to strengthen for the side-to-side motion, for that inversion and eversion. And that's really where physical therapy comes in. We can put together a specific program that's made for what you need to do in order to prevent excessive side-to-side motion. Now, if you've actually got an ankle problem, whether it's just global ankle pain, it's some swelling, it's a specific point tenderness, it's an Achilles tendonitis, it's arthritis, whatever it might be, then what we really need to do is evaluate your ankle, figure out what isn't moving properly, where the space isn't staying as open as it should be, where tendons aren't stretching out as much as they should be, and where muscles and ligaments aren't providing the support that they should be. Put together a specific program for you. Any ankle or foot problem can be taken care of, but it gets taken care of by putting a specific program together. So if you're having any ankle or foot problems, if you've had a history of ankle sprains, whether it's 1 or 30, if you've had a history of plantar fasciitis once or 10 times, etc., let the expert physical therapist here at Loudoun Sports Therapy Center figure out what's going on with your ankle and help you to be able to have a good, happy life that allows you to move around without any ankle or foot problems.